Assalamu alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnum Riaz. And I hope that you have been looking after your health as we've been discussing in our previous programs. Today, we've got a very important topic to talk about, and it's going to be nephrology. What does it mean? Who is a nephrologist? What skill does it take to manage a patient? And then exactly what kind of patient needs to go and see a nephrologist? So to talk about all that today and get lots of information, we're very happy to have with us in the studio today Dr.Nosheen and Manzoor, who is a consultant nephrologist and transplant physician. Dr. Nosheen, thank you very much for joining us.
Thank you so much. Assalamu alaikum, and thank you all for inviting me to this forum.
Walaikum salam. It's our pleasure. Well, you know, the thing I wanted to ask you sort of right off the bat was that many people may be confused as to what a nephrologist does. What area of expertise are they catering in? And also, when does a person need to see a nephrologist?
Okay. So to start with, what is a nephrologist? Now, who is a nephrologist? Basically, nephrology is a subspecialty of medicine. In nephrology, basically it deals with the health of your kidneys, the diseases of your kidneys, and what are the treatment modalities which are available for that. So being a nephrologist, our duty is to deal with the health of your kidneys.
Right. And how do we know that something's going wrong with our kidneys?
Basically, there are some signs that initially whenever a person is suffering from the kidney disease, they develop, and they include the decrease in the appetite, and there is the swelling of your feet, and it's slowly and gradually can increase, and it involves your entire body, and there is the frothing in the urine is present. And secondly, the blood pressure becomes very higher, your urine output sometimes it decreases, and it's very important to know that most of the times the kidney diseases, they do not involve that the kidneys they shout for help. No. There will be no pain, there will be a silent, patient will be calm and cool, but he will be having the problems. Like I have told you that slowly and gradually the appetite will be decreased, and he will be feeling very nauseated, sometimes having the vomiting and the weakness, lethargy. He is having the frothing in the urine and the body swelling, but the pain is not there. So most of the times it goes unseen.
Okay.
So I will give this message through you to everyone, that please do regularly have a look on your urine.
Okay.
Is it fine, or there is some froth on it? And if you have the body swelling, do consult your nephrologist.
If there's froth on it, what does that mean?
It means that it's one of the signs that your body is excreting the proteins from it. Your kidneys are they are getting damaged, and they are not able to control the protein to help back it in the body, and they are coming out in the urine. So it's not a good sign.
Okay. Yeah. Also, what about the color? Does that give an indication that there's something wrong with the kidneys?
Mostly, yeah, we have a very neutral color of the urine. But if there are some conditions that the color of the urine gets changed, but sometimes it's something present in your diet, like the beetroot, if the person is taking, or some medications like the tuberculosis medications, rifampicin, it gives an orange color to your urine. Otherwise, the urine is normal. And if we take very less amount of fluid, obviously, then the urine becomes very concentrated, it becomes yellowish tinged. So, and sometimes when we are suffering from some stone disease, then there is some blood in it, and it gives you a red color, and there is pain also associated. And in last but not the least, there are some diseases of the kidneys that are called the glomerulonephritis.
Okay.
In that, we might have the cola color urine, just like the cola.
Okay, yeah. Right.
So it's very important to have a check on your urine color, amount, and the froth on it.
Is this also something that we need to look out for in children?
Yes, because the kidney diseases, they can occur at any age period, and we group them accordingly, but they are present.
Yeah. Okay. You mentioned blood pressure as well. What is the relation between blood pressure and the kidneys? Is it the kidneys having a problem that causes the high blood pressure, or the high blood pressure causing problem in the kidneys? How do these two relate to each other?
Again, a very good question. Basically, remember one thing, that blood pressure and kidney, when we talk about the basic functions of the kidneys, so one of the function of the kidney is to have a control on the blood pressure by controlling the amount of water in your body, by having the control of the electrolytes in your body, and all these directly and indirectly have the effect on the heart, and this is how a vicious cycle and a balanced cycle is present in our body. So whenever there is some problem that is present inside the kidney, for example, the acute glomerulonephritis, it will disturb the kidney. Now the kidneys will not be able to control the fluid. They will not be able to excrete a good amount of urine. So what will happen? The body will retain the fluid. So this retention of the fluid, this retention of the salts in it will cause the activity of the nervous system, and then there will be the activation of the even a negative feedback on the heart. So heart will not be able to pump that amount of fluid. So there will be the rise in the blood pressure. So we can say in simple that the kidney diseases, they cause the blood pressure and they control the blood pressure, and sometimes if the blood pressure is not controlled, then it will directly damage the kidney also. So it's a continuous cycle.
Right.
Yeah.
A cycle that needs to be monitored, it
Yeah.
needs to be looked at. You need to have medicines for it, medications.
Yeah. And it's very important, I would like to mention here, that if you are less than 40 years and you are having the blood pressure, so never think that you are just having the blood pressure, you are having the hypertension. You have to look for the kidney disease also. You have to, every blood pressure before 40 years needs to be worked up.
Okay.
Yeah.
Okay. So many women get a problem with blood pressure in pregnancy.
Yeah.
How does that affect the kidneys, and how should they be monitoring it afterwards as well, after the delivery?
In medical terms, we call this situation the preeclampsia. Basically, there are two types of the blood pressures in the pregnancy. One is the chronic hypertension, that is the blood pressure that the female was suffering from before conception. So now she has conceived, but she has the blood pressure before that. This is called the chronic hypertension. But one blood pressure that occurs, high blood pressure takes place in the 5th month, that is the 2nd trimester of the pregnancy onwards. This is called the pregnancy-induced hypertension.
Okay.
So this pregnancy-induced hypertension, by definition, it subsides after the delivery. It's associated with the processes, physiological processes which are taking place during the pregnancy. So they are, it's basically that.
Okay.
So by definition, it gets settled after the delivery. However, this patient should be monitored closely, very closely in the postpartum period for the blood pressure record, and once stable, then even then after that, she should have her renal workup done once.
Okay.
Yeah.
Okay. If somebody suffers from swelling on their face, on their body, and they're not really sure what's going on, can that also be a sign of that you need your kidneys to be checked out?
Whenever there is some retention in your body, so fluid retention in the body shows that there is something wrong with the kidneys.
Okay.
You have to look it up. And secondly, it might be because of your heart, it might be because of your lungs. But if the kidneys are functioning very good, so it's normally they excrete the excess fluid.
Okay.
Yeah.
So basically you're ruling out different problems, and you have to work systematically. I think one of the main problems we have as a society is that we do tend to ignore issues. We sort of, if we have a slight pain, we were not going to really take much notice of it until it starts to interfere with our daily activities, or the pain gets out of control. likewise, the things you mentioned, any changes in the color of urine, the edema that you were talking about, the swelling, we usually sort of, okay, you know, it'll go away, or somebody will mention it, and then we'll just say, okay, fine. How do we tell our viewers, how do we tell our people to be, you know, assertive when it comes to health?
When you are above 40, to have at least once a year to have your urine RE, that is the normal urine analysis, to be done. In urine RE, we call it the ECG of the kidneys, just like the ECG of our heart.
Okay, very
So,
interesting.
yeah, we say it the ECG of your kidneys. Your urine tells what is going on. It's very important, and it's a very cheap test that is being carried out. So, must have the urine RE once in a year, your kidney profile that includes the creatinine, the urea, and the electrolytes of the balance of your body. And thirdly, you must have an ultrasound done.
Okay.
And if, God forbid, you are suffering from diabetes, or you are suffering from blood pressure, or any other comorbid, so you must have a nephrologist visit at least once.
At least
Yeah.
once, okay. You mentioned diabetes. Tell us what that does to the kidneys, because we spoke about blood pressure.
Basically, diabetes, it's nowadays it's the global health issue. And unfortunately, you know, Pakistan is ranking 3rd in diabetes. And we have a very poor control. If we have a very poor control of diabetes, what happens to the kidneys? Diabetes, they causes the molecular, the vascular damage of the kidneys, and it also involves the kidneys at the glomerular level. What happens? The basic filtration plant of the kidney is damaged.
Okay.
So what happens next? That the proteins which are supposed to be retained by the kidneys, they will not be retained now. They will be lost in the urine. Number one. Number two, due to this, there will be the increase in the sometime initially it occurs, and then there will be the fluid retention. Fluid retention, it will increase your blood pressures, and it will disturb your if it's not controlled at the initial stages, it will get aggravated. And what will happen, that your body gets swelled, and after this kidney damage, the symptoms, they slowly and gradually they develop one by one. And to start with your gut, you will have the loss of appetite, decreased vomiting, and lethargy, weakness, and your concentration ability gets lost, and your sleep cycle will be disturbed, and then you will present to the physician. Ideally, it's my humble request to all the physicians that, being the medical specialist, if a patient presents to you and he has the kidney functions, and we calculate them according to the glomerular filtration rate, that is the functional formula for the kidney, if it's around 30, you must refer the patient to a nephrologist.
Okay.
At the GFR of 30, the nephrologist is the person who has to take over. And then he will diagnose what is going on and what management he can offer to the patient.
Right, okay.
We have the management plans.
Right,
Yeah.
okay. So the main thing here is to catch this at an early stage.
Yeah, and to catch it and then to proceed
Treat it.
accordingly, not to
Yeah.
stop. It's very unfortunate, ma'am, that I have seen multiple patients that are being treated somewhere at their local healthcare centers, and the doctors, they are not doing the urine test for the patient even. They're just treating the patients. So it's you can say it's a message to the medical people that do have the basic labs for your patients, and if you see that there is some abnormality in it, do refer them to a nephrologist.
Which is very, very important, because
it's very
your basic health care provider, the person that you're seeing, they're the ones that will actually steer you in the right direction. Very, very important. And also awareness in general, as in the people who are watching today's show. If they feel that they have these symptoms, or a loved one or somebody they know, then, as we say again and again on this show, is that prevention is better than cure. That to be assertive, to catch something before it becomes drastic, or reaches a dangerous level. That's the whole point of this program.
Exactly.
And everything that you have told us, it's so simple. It's not rocket science. It's not something that, you know, I don't understand this, I don't understand that. It's very, very simple. If you have a symptom, if your kidneys are, you know, you're finding that this is going on, go and see a nephrologist, which is so important. Okay, now tell us about, you were talking about transplants as well. When does a person need a transplant, and how are the facilities in Pakistan?
Basically, transplant is a very good, a definitive treatment option, I would say. Before that, I would like to say one thing, that when we have the kidney disease and we say that the kidneys, they are now functioning less than the GFR that I have told you before, its GFR is less than 15.
JFR stands for?
The glomerular filtration rate.
Okay,
It's basically
GFR.
Tells you the percentage your kidneys are functioning.
Right.
In rough words, we can say it. So by definition, if the GFR is less than 20, we can even go for a preemptive transplant. That is the transplant without going for any hemodialysis.
Okay.
And there are basically this GFR, there are different guidelines which vary from region to region. We usually follow the KDIGO guidelines, and they say that if the GFR is less than 15, then start with the dialysis.
Okay.
Okay, replacement, that is the replacement modality for the kidneys. And if the patient is young and he is willing for the transplant, that is a definitive treatment, do proceed for it. And alhamdulillah, there are multiple units, very good units working in Pakistan. Even the SIUT at Karachi, it's providing the free of cost. The PKLI is another unit which is providing the free of cost transplants. And even here in Islamabad, we are providing the services and at very subsidized rates. And basically, it's after this kidney transplant, you have a new life with you.
Right.
Yeah.
And about donors and the matching of organs, this is usually found in the family, is it?
Basically, there are different systems that are being carried out in the world. There are 3 different types that we can proceed with. There is the life donation, that is any live person, related or unrelated, can donate. Healthy person can donate to a diseased patient that is suffering from the kidney. Second is that is the deceased donors. Yani ki once you are dead, you can donate the organs. Unfortunately, this is not being carried out in Pakistan. And third is the peer donor exchange program. It's again a life program, but life related transplants. But basically what happens that, for example, me and you, God forbid, we are the 2 recipients. We both are suffering from the disease. And you have the donor A with you, who is your brother. And I have a donor, my mother. But when we do the cross matches and we say that my mother cross matches, they are much more suitable with you rather than me.
Okay.
So we can donate, we can exchange the donors. So this donor exchange program is not present in Pakistan. It's basically the transplant registry which is taking care of it. So alhamdulillah, we are doing well, but it's again a request to our government that the other programs, especially the deceased donor, should be initiated here. Even we are not authorized to go for the non-related transplants. Non-related transplants means that the person is not my blood relation.
And we're not allowed to do that.
No, our government doesn't allow it. Our HOTA program, which is controlling
whereas that would save so many lives.
Yeah.
Because I'm sure that the donor
because of this donor limitation, we are not having a good amount of the good number of the patients. They're not getting benefited because they have no donors with them, or they have the donors but they are suffering from some. So potential donors are not available in the family. So the patient is suffering from the kidney failure and he is having the dialysis. So if the deceased donor program or the non-related donor program either of them they get started here, it will be much more beneficial to the community.
So for a person who donates a kidney, how do they adapt to living with one kidney?
It's a very good question, and it's being asked by every donor, that what would happen to me after I donated to my wife or husband. Or so let me share one thing, that there are multiple patients and thousands of people, normal people, who are born in this world, and they are born with one functioning kidney.
I see.
And they grow up, and I always used to tell to my patients that these people, they are not patients, these people, they grow up, they get their educations, they get married, they have children, they get old, and once when they reach their deathbed, one way or the other, they undergo the investigations, and they are found to have, oh, you are having one kidney.
Imagine.
So having one kidney is not the problem.
Right.
Having a diseased kidney is the problem.
Right.
So once you donate the kidney, you are gifting a gift of life to someone. So believe me that you will be much more healthy, and you will be having a much more stable life. No issue at all. However, you have to keep a check on your weight, on your blood pressures, on your diabetes, which are the diseases of increasing age.
Right, right, okay. So what counseling goes on between the donor and the recipient? Do you have any memorable cases where, because it must be emotional as well, especially between relatives, can a parent donate to a younger child, or is it an issue?
Actually, by the recommendations, the recommendations are that prevent to take the kidney from from a young with the age less than 20 years.
Okay.
Yeah. For recipient, there is no age limit,
Okay.
but for donation, it's regulation that
Right.
Better to avoid the patient donor less than 20 years. And for the increasing age, there is again no recommendation that you can't take a kidney. We have done a case, and the donor was 72 years.
I see.
And he donated his kidney to his wife, and alhamdulillah, both are doing very well.
That is a wonderful story.
Yeah.
At 72.
Yeah.
And because that is an age when you think that there could be complications or
and
something.
he donated it to her wife, and now both are enjoying a very good health.
That's fantastic.
Yeah.
That's a great story. Okay, right. Talk us through some of the tests that a person would go through if they came to see a nephrologist. How do you start? Of course, it would depend on a person's condition, but what are the basic tests involved?
Basic tests they involve are, once again, I would say that start with the urine routine examination or the urine analysis, and in that we do the specific gravity, and any blood is coming in it, any protein is coming in it, and the specific gravity of the urine. Then we do the kidney function tests, that are the urea, creatinine, and the electrolytes, that is the sodium, potassium, chloride, and the bicarbonate. And then we do the blood complete picture, that is the to look for the hemoglobin, because you know that the functions of the kidney, they are not only producing the urine, but they have the multiple other functions that we can discuss it later on. However, coming to the next test, that is the ultrasound of the kidney.
Okay.
These are the 3 to 4 basic tests for a general screening of the kidney disease. Then once we get these, and if we see that there is some protein coming out, then we quantify it. We quantify this protein by measuring the 24 hours urine of the patient, and then we quantify the protein coming in.
Right.
It comes in grams.
Okay.
So we do it. And then depending upon the cause, if it's the stone disease, we go for the CT scan, and if it's the disease inside the kidney, we go for the kidney biopsy. That is a small piece which is taken out from the kidney to have a histopathological diagnosis, to see it under the microscope, and then we staged up, and then we classify it accordingly, according to the findings over there.
Okay.
And then we have the treatment options.
Right.
So these are the basic tests. Although sometimes more advanced tests they are sometimes required, like the MRI of the kidneys, in order to look for some pathologies. And but these are, however, these are the basic tests. And along with, there are some autoimmune diseases that are affecting the kidneys, so we do for the autoimmune serology. That is the test like somebody is having the recurrent abortions, and now the female is suffering from the kidney disease. So she comes to us with the swelling. We see her, we sit with her, we take the history, we do the basic labs, we quantify the urine, and then we think that it's something autoimmune process that is going on, and that process is involving the kidney now. So what we do the kidney biopsy, but along with that, side by side, we do the autoimmune profile. That is the number of tests, and they show that there is something, primary disease, that is affecting the kidney.
I see.
Yeah.
Okay. So sometimes it's a symptom of something else.
Yeah.
That
Because
then
kidney
you
is
work
the main
backwards.
filtration plant of your body.
Right.
It's
right.
down, it's filtering your entire body. So you might have the disease somewhere else, and now your kidneys are getting affected secondarily.
You mentioned kidney stones. Because we live in a hot climate, and you know, sometimes a person really doesn't even know about what's going on with kidney stones, and it seems that there's a lot. Many people are diagnosed with kidney stones. Is it something to do with genetics? Is it something to do with our area in the world and lifestyle? Tell us who is more at risk.
Actually, I would like to appreciate your knowledge. You have a very good knowledge, and it's very important for all our viewers to screen themselves accordingly. Kidney stones, there are different types of the stones.
Right.
Sometimes they are related to the genetics.
Okay.
And secondly, we will go through it later on, that the stones that the disease which is the hyperoxaluria, that is the oxalate stones formation in the body. It's basically a genetic disease.
Okay.
Secondly, there are some stones which are because of the decreased fluid intake and working in the outside and having no fluid at all. So they are most commonly they are the calcium oxalate stones. Thirdly, there are sometimes when we are dealing with they are present in the diet. Again, at some sort of oxaluria, oxalosis, and oxalate stones, and sometimes the other stones. So there are different types. The genetic causes, your environmental causes, the environmental factors, and the body of the patient. So they are important, and accordingly we classify the patient. We basically what we do, we after the history of the patient, we get to a point that this might be the cause. If the patient gives me the history that I am taking so many calcium supplements since last 6 months, and now I am having the renal colic or the renal pain, then for me it will be most commonly, I would say that it might be the calcium stone. If the patient is suffering from uric acid, and then I might think for that uric acid stones. But again, very important thing, that there are some diseases, again they are most important, the autoimmune diseases.
Okay.
They are the diseases and which the patient for the first time ever in life presents with a stone, and when we do the workup, it comes out to be the other cause, that is the autoimmune disease.
Right. Okay.
Yeah. And this is how we go for the stone diseases.
Okay, okay. So once someone has been diagnosed with one stone or sometimes more than those, what is the next line of action?
If it's the one stone, single stone, and no previous history, no family history, no positive drug history and nothing, so we deal it according to the size and the density of the stone. And if it's a small stone, less than almost 9 millimeters, usually it passes by its own. Otherwise, we have the medical expulsive therapy. That is, we give some alpha blockers to the patient, and we advise him to take the plenty of fluids. However, if there is a history of multiple stones and the patient says that he is passing the stones on and off since last so many years, and there is also some positive family history in the present, and some of the family member even has ended up with the dialysis, so we must go for the genetic workup. And this is a very good news I would like to share, that now these tests, they are available in Pakistan also. Initially they were not present before 3-4 years back, but now they are being carried out here. Genetic workup for the stones. And the most common is the hyperoxaluria, that is the, and we have done this workup for a number of our patients. And if they get this genetic gene positive, then they go for the liver and kidney transplant. Not only the stone in the kidney, but the basic pathology is present in the liver, so they have to go for the liver kidney transplant.
Both together? Oh,
Yeah.
Oh, I see.
It's being carried out in Pakistan.
That must put a lot of stress on the patient as well, to have both organs.
But if you are suffering from a disease and after this treatment you get a new life, healthy life, so
then
good,
it's worth it in the end. Okay. Children. We, in summer we'll see that they're running around, they're perspiring a lot, and lots of children are addicted to fast food, junk food, and these, drinks, the cold drinks, soda drinks and that. How much does that interfere with a child's kidneys?
My child is, eldest child is in class 3. Yesterday he was sitting with me and he was saying, "Mommy, what is a balanced diet?"
Oh, wonderful.
So I asked him, "What is your concept, beta? What is your concept regarding the balanced diet?" He said, "Mommy, I think if we eat the junk food too much, it will make us fat. And if we take the only one thing in our life, we will be suffering from some deficiency of the other type." That's why I think we are the favorites of our God, and God has made us omnivores. Yani ki God has made, He has not made us herbivores, that we are only the vegetable eaters. He has not made us the carnivores. We are not the only the meat eaters. We are the omnivores. So I think, Mommy, it's basically a balanced diet. Is the one which has the each and every ingredient of the diet in a well measured, balanced amount. So what I would say, that the children, they are being given this concept at the school at very early years. So it's our duty that we have to implement. So it's not the issue. Yeah, it's yani ki the concept is there, and the children are taking it. Now it's our duty that we have to implement it, and we have to encourage them to avoid that. And it's mentioned somewhere that one glass of this cold drink, it consumes 7 glass of water from your body. So if we are consuming these cold drinks, so we have to use a plenty of water with it. It's better to avoid them.
It's better to avoid them. Why is there this addiction with them? Why is it the sugar factor? What is it? Why do children sort of, not even just children, even adults, honestly speaking?
It might be the taste, I don't know, but it might be the taste.
What could be an alternative to that? What could a person, especially in summer drinks?
We have the lemonades. You can give the homemade lemonades, the fresh fruit juices. So we should encourage, and the green tea to the adult ones.
Right,
so
right.
Apart from the cold drinks.
Right, okay. What foods are kidney friendly, if I could say? I read somewhere, I don't know if it's right or not, but kidney beans, because they're shaped. I read it somewhere, I don't know. You could be able to tell us, debunk that. Is it a myth or is it a truth?
I think I have never seen any fruit with a heart shape. So I don't think that a kidney is related to the kidney health. This beans are related to the kidney health. But if the person is suffering from the kidney disease, we advise him or her that you have to avoid the diet, the foods which are more carrying the more amount of those elements which are not being excreted from your urine.
Okay.
Like if the patient is suffering from kidney disease and he is having the kidney disease stage 4 or 5, his kidney is unable to excrete the phosphorus from the body and the potassium from the body. So what I would advise to my patient that avoid those fruits which are high in phosphorus, which are high in potassium. And now the phosphorus foods are the dairy products.
Okay.
And the potassium fruits are the banana, mango, and these things, grapes nowadays. So
Okay.
we don't restrict usually, but we restrict the patient according to the reports which are available.
Right. Okay. So when we talk about our lifestyle as well, are we getting enough physical exercise? Does that make a difference as well?
Yeah, because you are physical exercise makes you fit, makes the balanced weight, and it's very important not only to have because it's the basically the protein burden which are you giving to your kidneys. So if your kidneys are not getting any burden, they will function more good.
Right.
Yeah.
Very, yeah, there's a common sense.
Yeah.
A very good answer there. So the BMI of a person, that matters a lot. If we are, you know, sort of like overweight, heading to obesity, then we are in fact putting, as you use that word, a burden, not just on our kidneys, on the rest of our organs as
Every
well.
organ of the body.
Yeah.
Every organ of the body. And there is one of the disease in the kidney, that is the obesity related focal segmental glomerulosclerosis. Now it's the histopathologically diagnosed and the well known disease. Secondly, the obesity prones you towards the diabetes. Diabetes again damages the kidney. By having the more BMI, you will be suffering from the blood pressure. It will again damage your kidneys.
It's just a cycle, vicious cycle going around and around.
Yeah.
So if we sort of take out the denominators, weight, lifestyle, diet,
Yeah.
and
if you're diabetic, then bad control of the diabetes. You must have a very good control of the diabetes. If you are having blood pressure, so you have to avoid it, the uncontrolled. Be very much compliant to your medications.
What hidden foods are there? I mean, of course, if you have blood pressure, you're going to think, I'm not going to put salt on my food, or I'm going to have something, you know, less salt in the food that we are making or preparing. What other hidden foods are there that have a high sodium sort of, amount, but we're unaware of it?
No, basically the seafoods. Whenever you take the seafoods, otherwise it's always recommended that avoid the additional food that we sprinkle on the fruits, and so avoid the added food. Salts, sorry.
Right.
So a person normally is allowed to have the 6 grams of salt on daily basis. That is the teaspoon.
Okay.
So if we limit our salt intake to that teaspoonful in our 24 hours, it will not affect your taste, and it will be beneficial to your health.
Right. Urinary tract infections. They seem to be more common in females than males because of anatomy. How can you avoid it? Also in children, little girls as well, and women growing up. What are the signs, and when does a person need to see the nephrologist?
Basically, as you have already mentioned, that females are more prone to this urinary tract infections because of the basic anatomy of the body. But for how we can prevent it, first rule would be the good hygiene. Secondly, avoid the public toilets and wash yourself with plenty of water, and according to a specific method. The water should go from front to back, and then secondly you have to dry yourself and after before coming out of the washroom, and secondly wash your hands, and if you are having some burning in the urine and you are having some pain during passing the urine, or you have some itching, sort of itching, so must have a urine RE done. And if it shows that there are some bacteria are in it, so you have the culture and sensitivity test of that urine, and then according to that special bug, which is the specific bug which is causing the infection, you get the treatment.
Right. And
Yeah.
for this, you can do this yourself, or you should go to see the nephrologist? What?
No, if you are a medical person, so you can, but if obviously if
you have these
you have to
symptoms.
choose among, but if you are suffering from this, you go for the medical specialist or a nephrologist. Secondly, if you are having the recurrent urinary tract infections, then you have to look for the other causes. Like sometimes it might be that you are also having some vaginitis also, and secondly you might have some stone or something in the bladder or in the kidneys that is a nidus for the infection again and again. And you know, we have some stones which are called the infectious stones. They are because of the untreated recurrent infections, and these are the triple phosphate stones. These are the, if you see the picture of these stones, they are very scary. So these are the basically the basic pathology is the continuous infection.
Right, right. Dr. Nosheen, thank you so much for being with us here today. I mean, you have given us a absolutely informative, packed episode, and I'm sure that anybody who has had any concerns regarding their kidneys or nephrology, they would definitely be much more clear-minded, and you know, it would make things easier for them to how to look after their kidneys. Before we go, I'd like you to give a quick message to our viewers and to tell them basically how to be kind to their kidneys.
I always tell my patients, request my patients and request my every person who is around me that love your kidneys. Take plenty of water, avoid the painkillers that are over-the-counter drugs like the Brufen, Caflam, Synflex, Dicloran. Avoid these drugs until and unless you are suffering from a very severe pathology and your doctor is prescribing them, and but better to avoid them, and if needed then take them not more than 24 hours. And after, and number 2, do have, if you are crossing the 40, have your baseline labs, as I have mentioned you before, even once a year. And thirdly, if you are diabetic, have a very good blood pressure and blood sugar check of your on regular basis. And thirdly, God forbid, if you are suffering from the kidney disease, don't get depressed. It's just a disease. There are the treatment modalities, and even we have the transplant facility with us, and proceed for it. Disease comes from Allah's side, and it's our duty. We have to look for the treatment, and we have
Fabulous.
to proceed.
That's absolutely amazing. That's such important information. The one about the painkillers, you know, that was got me listening to that, because so many of us are used to getting those pain medical, you know, medication relief and not thinking what it's doing to our body.
Exactly.
So that is so important. Thank you again for all your time.
Thank you.
And so that's all we have time for today. Until next week, stay happy, stay healthy. Bye-bye.